Welcome to the podcast, Dr. Jeremy Ciano.
Hey, how you doing? Thanks for having me.
For those who haven't had the pleasure of meeting you or for seeing you speak, can you, before we jump in here on the topic that we're going to explore today, give us the 2 minute highlight reel, the back of the baseball card for Dr. Jeremy Ciano?
Sure. Moved out to Indiana about 25 years ago. I'm an East Coaster by birthright, and started practice about 18 years ago for an adult clinic, and we had some success. So we decided to try a pediatric offshoot about 12 years ago, and then 2 years ago we opened up one more of each in a community about 20 minutes away. So we've got four practices: two adults, two kids. Two of them are very mature and kind of hitting capacity, and two are fledgling infants. And it's kind of like my family, four kids. You got two older ones in college, and we got two younger ones at home. So I get to parent and grow my business very similarly.
Except you get to make money in the business when as parents, we just seem to lose money.
This is true. The older kids cost a lot more money, but the older practices make it back. So I guess it's all a balance.
It balances out. So just to be clear, you have is it two practices then that see only kids? Is that correct? And what do you define kids in terms of age range?
We're 13 and under for the kids practices, and 13 and above for the adults. It's not a hard line because all of our doctors see patients at both the pediatric and the adult clinic. So we're kind of soft in that. Sometimes you get an 11 or 12-year-old kid that's 5'10" and they're the size of their parents, and they want to come see the same doctor up at the adult clinic. And sometimes you get a 15, 16-year-old that's really shy and they're tiny and they still fit in the kids' glasses. So we're it's 13-ish is our cutoff.
So it's interesting, and that's what we're going to talk about today is pediatrics. And as we were talking before we hit record, there may not be as many doctors out there with the admiral aspirations that you had to open up practices that were exclusively devoted to kids, but we all have to see kids. It's an element of the practice that we probably need to treat a little bit differently. So that's what we're going to really dig into today is the pediatric side of things. And when it comes to pediatrics and eye care, it's kind of a mixed bag. Some ODs seem to really like working with kids, even infants, and others find maybe it's not where they shine. I think if we're being honest, it takes a certain personality to deal with kids all day, maybe a certain level of patience to be specializing in the age group, most likely to be hanging off a phoropter while the little brother throws toys at him from across the room. So we'll get to the staff part of that because that's interesting too, because it takes a team. But I want to lead off by asking you about the doctor and the qualities necessary. If someone were looking to devote considerable resources to pediatrics, what would you say are the qualities they should have? Me personally, and I think self awareness is a good thing. If I saw kids all day long, I think I would find them really cute up until about 2, maybe 3 o'clock. And then
That's longer than I would last. Yeah,
that's a
that's
lot.
good.
What would you need in what kind of qualities or personality should you possess to be successful in a practice that specializes in the little ones?
Yeah, I think it's a calling. I mean, it really is. It's a really weird niche because not everybody wants to do it, but those who do are passionate about it. And so, from a recruiting standpoint, we've been able to pick up. We're up to 7 doctors in our clinics now, and myself and one other docs are the only ones that don't go back and forth between the kids and the adults. So I would say that the compassion and that calling for helping out the kids has been tremendous. There's been a real strong talent pool that when we put up job applications, we've really been able to recruit some doctors that are outstanding. And they love the fact that they get to do both the adult clinics and the pediatrics, because I think having variety in everything in life is one of the keys to success and longevity. One of the things in our profession, people talk about burnout all the time, and having this subspecialty half the week has really energized some of our senior docs, and the younger ones, they seem to love to go back and forth between the two practices. So we're very happy with that. But back to your question of what it is, I really think that that empathetic and that care, the challenge of seeing the kids has been tremendous, and it's really neat. I mean, all the moms in our clinic seem to do very well with their fellow moms who are the parents of the patients. So it's a great situation.
What does it look like when you walk into that practice, little eyes? And again, I'm going to um, suggest that again, maybe not every OD would want to create a practice exclusively devoted to 13 and under age group. However, I'm curious what's the look and feel for the mom, the dad, the child walking into that, and then maybe a part B of a two-part question is what should the feel look like to any practice that is catering to kids, even if it's not exclusive?
Yeah, it's bright, airy, and open. We went back and forth a lot of different discussions of where we were going to make from a decor standpoint, because if you're too babyish, the 12 and 13-year-olds aren't going to want to be there, and if you're too teen, it's going to be intimidating for the little kids. So we went with more of a primary color kind of thematics, if you will, and it's a balance, because we do see kids that are one, and we see these 13-year-olds that want to have some fashion and style, and you can't be too extreme, and I think that goes for really for everything in life. But it's an open format, and the doctors are very the doors aren't closed. It's a pretty open romper room, for lack of a better term. But we make everybody feel welcome and home, or at home when they're in the clinic, and it's pretty cool.
Is it a lot of families? I would imagine that you're seeing multiple kids. So there's that element from a business growth standpoint. Uh, you're seeing the brother, the sister, and do you find a transition also in the parents coming in, becoming patients at your other locations?
We do. I think that's the secret sauce. It is. It's pretty crazy, because a lot of the moms are coming in with multiple kids. Sometimes they're getting multiple exams at the same time, which is tough. If you got a kid in a stroller, you got a 5-year-old, like you said, hanging off the phoropter, it can get pretty wild and crazy. But that's the fun with it. A lot of the trust that gets built up once the moms fall in love with these doctors who do such a great caring job with their children, they end up becoming adult patients at our other clinics. So it is. It's not. To an extent, it's a farm system. That's not the primary reason why we did it. But yes, the translation, as the kids graduate, they come up, and as the moms build confidence with these pediatric specialists who are also seeing the adults, they tend to gravitate over and switch clinical care over as well.
How is the communication different in this office? Because you're having conversations with um, a lot of parents, but you as I was reminded once from a doctor that does a lot of myopia management, she said I need to be careful when I swivel to talk to mom and dad that there's a 7-year-old sitting next to me that's feeling left out of the conversation. And I need to make sure that they're part of that, and I need to adjust my own conversation so everybody feels included. Do you how do your doctors adjust their communication style for this different demographic?
I think simply sliding the chair over and sitting next to the child. So when you're talking to the parent, you're kind of sitting side by side with the kid. It breeds a lot of confidence and a lot of, I guess, camaraderie. It would be a good word for that as well, because the kid wants to be part of the conversation. Obviously, it depends on the age, but you don't ever want to talk down to a child, but you also don't want to leave them out. So sitting in between the parents and the child is not always the best positioning. So sliding the chair over, sitting arm in arm with the kid to talk to mom seems to be the most constructive way to get that conversation through.
Is there a I, my question is how do you balance fun with professionalism in in this demographic? Because sometimes feedback can be golden, and I remember once early in my career I was talking with the patient, and she stopped me and she said, why do you look so serious? And it really got me to think. I didn't feel like I was coming across that way, but it was just a reminder at that point in my career to not take things so serious. And I came to realize how much I like a doctor that's kind of chill, laid back, isn't afraid to joke around. It puts you at ease. So how do you balance that dynamic in this kind of practice, that fun versus professionalism aspect of it?
Yeah, I mean that's our style. I mean, it's kind of laid back. I mean, from a dress code standpoint, most of the docs are in scrubs, or we'll do scrubs on the bottom and a t-shirt. It's kind of you're going in to have a good time. You know that it's going to be controlled chaos because you never know what's going to happen with the kids, what they're going to do, what they're going to say, and so it is. It's a light and fun environment. The team really knows that anything could happen, and we go with it. You know, there's no scolding or reprimanding people. You just kind of laugh. Now you got to keep them in check because it can get out of control if you don't have the gates up and the kids are crawling around all over the place. But from a doctor's standpoint, I think that they just know. And like I said, I think the contrast of not having to be so serious with the glaucoma patients or your macular degeneration patients to be able to talk and have fun with these kids that are going to be, getting glasses for the first time. And we've all had that story where we said, the first time we saw a kid that gets a pair of glasses, it was a life-changing moment. I think every 90% of every optometry student uses that story in their interview process. But we get to live it every day and seeing these kids with these brand new glasses, and it's pretty sweet, it's pretty rewarding. And we keep it light and fun, and it doesn't have to be serious. I mean, we've got the plaques on the wall. Everybody knows that we have credentials. We don't have to, beat our chest and wear that, the white coat to command authority. We're just friends and colleagues, and that's how we approach things. Is that they're moms as well, and they approach them as if they're at a PTO meeting with their friends, and that's kind of the attitude that we take with the institution there.
And if you can't have fun, I'm not sure you should really be devoting all your
Yeah.
share to kids. So I've asked a question before when people have asked me about a specialty, what specialty should I go into? Or specifically, they were interested in either pediatrics or more specifically something like myopia management, where you do
Hmm.
see a lot of kids. And the first question I'll usually ask, I think, is not the one they expect. I'll say, or I'll ask, do you like kids? And it's okay if that's not your thing. It's okay if you're more, 90% professional and 10% fun. Not everybody's wired up this way, but I do think you should put some consideration into, do I really like working with kids? Because I just think you're going to generally be much more successful um, in that realm. You talked briefly before about the design of the office and the look and feel that you would want as part of your brand when somebody comes in, a mom comes in with their kids. Tell me a little bit about the staffing part because it does, as we mentioned before, it takes a team, and when mom's coming in with her kid, it could just take one bad interaction in terms of the experience, whether that be with her, whether with its dad, or whether it's with the child. So, what do you look for, and how do you train the peripheral staff?
So very similar. It's, we've all had a really difficult time the last 5 years hiring people. I mean, I think universally our industry has been really capped out. We've been incredibly lucky that although it's a smaller talent pool, those who want to work with kids and pets for whatever reason seems to be a very similar psychology. But when we put out ads for hiring with the adult place and the kids place, we probably get a 10-to-1 ratio of applicants that want to work with kids. And it really is a calling. And so it's really neat to see the empathetic, caring mindset that people come in. They want to have fun. They want to be caring. They want to, do something special with these kids. And, from an interview standpoint, there's not a lot of questions that we have specifically about that, but we just talk about their interactions and why do they want to work with kids. Almost making that assumptive close that, of course you like kids, otherwise you wouldn't be here. But they always have stories, and everybody's got a niece or a nephew or a kid themselves, or they used to teach preschool, they used to be at a vet clinic. And they have this calling and they want to help other people. So it's been really refreshing and a saving grace during the last 5 years of chaos.
Jeremy, how's the marketing work for this? Is that anything you actively do as far as any kind of outreach SEO website? Is it more internal marketing? And there's always the um, other elements of this, like outreach to schools or screenings,
Huge.
things like that.
Huge. Getting a behemoth off the ground was really tough, and I would say that the grassroots guerrilla marketing that we did, especially the first couple of years, and what we're doing currently with our new practice has been tremendous. We, you start with a very small amount of patients because it's not a known entity. I mean, the pediatric, everybody's got a pediatrician, everybody's got a pediatric dentist, but pediatric optometry doesn't really, exclusive pediatric optometry doesn't really exist for the most part in most marketplaces. So getting that word out was tough. We do 19 elementary schools where we do the school screenings every year. We've been doing that for 12 years. I would say probably our biggest internal marketing campaign was simply writing letters to every pediatrician after every single visit. And our mantra was, you write a letter until we are told don't write us letters anymore. And we wanted to flood every pediatrician in the area with as many letters with our letterhead as possible, so that the front desk always were opening up things from little eyes. The doctors would get feedback from little eyes. And even if it was a perfectly healthy kid, which over 50% of the kids that come in are emetropic. Um, it was just great internal marketing that these pediatricians couldn't help but to refer to us when they did have kids with problems. So that was probably the single best thing outside of the normal standard SEO and website and blah blah blah, pay per click, all the same crap that everybody does. That's really a dime a dozen. And I mean that with all due respect, because we spend a lot of money on all that stuff as well, but it's nothing's really tremendously differentiating in our industry when people are just paying for the same clickbait. But that internal stuff was huge. And then of course the schools give away a lot of free exams, especially to school nurses was a big one as well. Every time we would do a school screening, we'd always leave 2 free exams for the school nurse for kids that maybe couldn't afford to pay for it, and the school nurses know about that. So we thought that about giving back was a great way to start the clinic as well. We still do that to this day. We're also involved in some charities. We have a program where for every pair of glasses that we've sold, we've made a donation to the Indiana Blind Children's Foundation from day one, from the first pair of glasses. So we put that out there as well. So the parents really they get a kick out of the fact that they're helping others as well. So those are probably the biggest ones.
There's a real nugget there. Do you find that the repeat exposure to your letters and outreach built trust? Because I think there's something to be learned there, because a lot of ODs who want more referrals from other MDs might send out one letter introducing themselves, might want to meet with the doctor, show up at their office. It becomes a little pushy, a little invasive if
Right.
the doctor doesn't want to give their time, or trying to bribe them with cookies or something like that. In your case, it was an ongoing effort of just communicating with them. And it sounds like for you, that's been successful in terms of building trust over a period of time. Not one letter, but the more they're exposed to you, the letters that you get, your brand, that you become top of mind in that doctor's office.
Huge. That's exactly it. I mean, being top of mind across the board is what we're going for. We still do that. We would drop off coffee and donuts, and especially in the beginning when you're slow and it's easy every quarter to do that. But we all get busy. I mean, I have people that knock on our door all the time and we have drug reps that are bringing new products into us all the time that we forget about. But if we could hit an office on a daily basis with multiple, and we would do multiple envelopes too. It wasn't just put in six, don't put 6 letters in one envelope. I want 6 envelopes, pay for the postage, flood them, and get to the point where they're pissed off, where they're calling and saying, stop with your letter campaign. Because that's when we hit saturation level, and we know that they know that if they ever had any kid that was going to have any problems, they're going to send them our way. And that has been incredibly fruitful over the last decade plus.
When you say letter campaign, just to be clear, are you referring to follow-up letters, or
Yes.
letters? Okay. Is there any other kind of marketing outreach, or is it just, hey, I saw the patient of yours, here's what we found? that sort of outreach?
Yeah, in the beginning, when we first put our flag in the ground, we sent out letters to 50 pediatricians, approximately 50 pediatricians in the area. Hey, we're new, we're seeing kids. If you have anybody, blah blah blah. Um, that's okay, but you're going to find there's going to be some doctors that are going to refer to you and some that aren't. So once you start seeing who's sending them your way, and we just keep that constant feedback, the biggest referral center, honestly, was our pediatric surgery centers here in Indianapolis, because there is a huge need for pediatric care, and the surgeons were over flooded. They were thrilled that we can do primary care, got it off their plate. So they became a big referral source as well, especially once the trust factor that we knew what we were doing. And surgeons want to cut. They don't want to flip dials, and that's right in our wheelhouse. So that symbiotic relationship has been tremendous as well.
Well, I would imagine with those letters, there's an element of being able to educate the other doctors as well without offending them, right? Because
Yes.
a lot of ODs, I still hear it to this day, struggle with pediatricians who do a screening and say you're fine. You passed your exam, you're fine because you can read a chart out there, and that's still a gap in pediatricians.
Mhm.
They just don't get the same level of trainings. But I would think being exposed to those letters over and over, they start to sort of educate without feeling like somebody's telling them that they're doing something wrong, right?
Exactly. That's a good one. And then the other thing, when we do the school screenings, we always give the kids a take home with like a 5 point checklist of some of the things that we screen for. And, we give them a pass or fail. And so it's a small educational blurb as well for the parents to know that, we did a pretty good job with the screening. Obviously, when you're seeing 100 kids in an hour, there's only so much you can do. But it does reinforce who we are, the thoroughness that we're dedicating to the community, and that has been another tremendous source for patient referrals.
What do parents value most?
I think the confidence that their kids are getting a thorough exam. I think that's probably the primary reason why they come in. Again, over 50% of our kids are emmetropic. So from a business model standpoint, anybody's listening out there, it's not it's not puppy dogs and rainbows. It is some tough sledding when you are doing 20 exams a day, and walking in that 10 of them are going to not need any type of hardware. Um, but those who do, obviously, we're right there for them. The other thing I was going to say, the confidence in the medical examination is huge for these parents, because that's why they're going to a specialist. But the other thing is fitting their little kids with glasses. I mean, some of us, we'll see families from cradle to grave, right? We'll see from 9 months to 99 years, but they might have one or two frames out there. We've got 300 frames in stock for kids of all ages. You got those, the rubbery ones for the babies, that kind of the strap-on ones, and you got some fashion ones for the 11, 12, 13-year olds. So we've got a really cool selection. So we have a lot of confidence with the patients and the parents, that if they come in, that they're not going to be stuck in pick one of these five horrible looking frames that have dust on them. They've got some new updated fashions. So that's another big one as well.
It's very admirable what you've done. It feels risky though to me as well. And I don't know how you felt. Maybe you were comfortable from day one, or maybe you were losing sleep over this. But basically, to take a 13 and under means, I know you said there's sometimes a soft line there, but that's a pretty good chunk of the population. We're saying you can't come here.
Yeah.
And I know the upside to that when you niche down, but um, in a somewhat unique model, what is something that at this point you look back and say, "Ooh, I wouldn't have done it that way"? Is it what have you learned through this process?
That's a great question. We learn a lot all the time, and there's been a lot of reinforcement with the new practice with this learning curve. I think that the biggest learning curve was probably in the staffing, that we niched out too much, and we didn't have as much cross training to use the same team members the doctors were capable of going back and forth, but we kept the teams separated. And I think we would have done a better job with a lot more cross training. We found that a lot of people want to work at both offices, and I think at the beginning to keep it totally niched and specialized, hyper specialized, was probably one of the bigger mistakes that we made. And now when people join our family, they are cross-trained on both the adults and kids. And it helps out for so many different business reasons, but it also gives I think the staff the same flexibility and the same reward to go, fast and strong selling glasses, and then slow and kind of crazy fun with the kids. So the team element was probably the biggest thing that we dropped the ball on.
I would think child psychology would be a good skill to have in this. And we just look at, I was thinking as you were talking about the efficiency side of things, and you get away with this a little bit more with adults if your office isn't running as efficient as it could, because they're probably not going to, roll around on the ground throwing a tantrum, although we've all had those adult patients as well.
Yeah.
But the kids, is that something that you sort of, you pay attention to the amount of time that they're in the office? Is there a certain flow to make sure that they're not sitting around too long, getting hungry, getting irritable?
Yeah, with the younger kids, we've made some scheduling adjustments where we are starting to see the real little kids before lunchtime. What we found is, sometimes the moms want to, they'll pick up their 8-year-old from school and bring in the 3-year-old for an examination after school, and the 3-year-old, it's nap time, and it's or 2-year-old, and it really is inconvenient and it's difficult for them. So trying to make that schedule work, especially with the younger age kids who are not in school yet, to force them into those morning shifts was one of the biggest hurdles that we had to get through, because for obvious reasons, everybody does want to take their kids out of school if they don't have to. And so from that 3 to 6 o'clock slots, they were, we were booked up, and reluctantly people didn't want to come in early on. Now that we're booked out, 4 weeks in advance, people are taking their kids out of school because it's becoming not a forced issue, but they're taking those smaller slots. But the age change to make that earlier appointment slots for the non-school age kids was critical.
And then last question for you. Are you doing any kind of specialty care in these practices with myopia management, vision therapy? And if so, what big of a segment, or what kind
Right.
of percentage of the practice would that make up?
Vision therapy, no. That's probably the biggest question we've gotten from day one, was how on earth are you going to do a pediatric place without vision therapy? And that's a whole nother podcast for the business model of why we chose not to do that. Um, but we have our reasons and our metrics to support that. But myopic control has been huge. I think we're the largest in the state. I could be wrong, but from our vendors, that's what they tell us, and our reps. Which, for obvious reasons, we got 2 pediatric specialty places. We should be huge in that. And that's growing. That word of mouth from the Ortho K and the soft lenses in that space as well. We do very well, and patients love it, and that success breeds success. So yes, I would say that's our hyper specialization, because the peds that's a specialty calling, as we just talked about. But yeah, the hyper focus on the big ticket item of Ortho K, that's what pays the bills.
Well, thank you. This has been great. Like I said, I admire your from a business standpoint, and solving a need is really focusing. I don't think a lot of doctors have done that, focus specifically on that segment, but there's a lot we can take from that just in terms of treating that demographic, even if it's not something we're treating exclusively. Is this something I think I read on your website you do some coaching and consulting for other ODs in this area or other areas?
Yeah, I did a lot of consulting work earlier in my career, travel around the country, worked with, I don't know, 40, 50 practices. And I love it. I love the profession. I love helping out. I think that one of my missions is to not let our profession become a CVS or a Walmart. And as private equity has put their nose into our business, these smaller independent practices are becoming more specialized, and we're kind of falling off. So I'm hoping that we can revive our profession and give everybody the confidence to become their own boss and create their own destiny, and really help themselves and help the profession at the same time.
Awesome. Awesome. If someone wanted to reach out for you for help, is there any specific direction they should look for Dr. Jeremy Ciano?
Yeah, just fine. I mean, I'm pretty accessible, man. I mean, anybody can text me, call me, email me. Everything's on the website. I'm pretty easy to get a hold of, and I promise I don't bite. Just here to help, and love, like I said, love helping out our colleagues anytime I can.
Awesome. And we'll link the website in the show notes, if that's okay.
Sweet.
Awesome. Well, thanks so much,
I
Jeremy, for your
appreciate
time.
it.
Appreciate it.
Yeah, thank you so much.
So yeah, thanks to Jeremy. Thanks everyone for listening, and we will see you in the next episode.
Great. Thanks for having me.